Hello, I'm Dr. Bill Otchin, Senior Vice President of Science and Quality at the American College of Cardiology. The ACC's mission of transforming cardiovascular care and improving heart health includes a focus on bettering the health of patients and the population at large. That emphasis on patient-centered care is an important part of ACC President Dr. Bill Zogby's goals for the upcoming year. Dr. Zogby is here with us to talk about why patient-centered care is so important and the partnerships, programs, and tools the ACC has developed to make it a reality. Dr. Zogby, welcome.
Pleasure to be with you, Bill.
Thank you. My first question is to ask you, what is patient-centered care?
Patient-centered care, although may seem obvious, Bill, is a care that is respectful and responsive to patients' needs, wishes, and preferences. So we're putting the patient at the center of that relationship between the healthcare provider as well as the patient.
Well, this is a new emphasis, clearly, and I wonder, why should cardiovascular professionals be interested in this? Why should they care?
Although it may seem intuitive that a healthcare professional really not only values but engages a patient, I think in the 20th century, if you look reflectively on it, most of the care has been disease-based, if you will, or at times more clinician-centered. And since our mission as healthcare professionals is to improve cardiovascular health and health in general, and if you look at patient-centered care, if that is practiced, it has several advantages that go well hand in hand with the mission of what we're trying to do, which is patient-centered care had been shown to improve quality of the care, improve patient outcome, and improve adherence to medications, and therefore better compliance and overall better satisfaction. In addition, is probably the best deterrent against malpractice against physicians, because there is much more engagement, a better relation between a physician and their patient.
Well, we're certainly all in favor of that. Bill, can you speak to us a little bit about some of the ways that the ACC has been involved in shaping and defining patient-centered care over the last several years?
It is inherent to our mission, really. A focus has been during Dr. Fred Beauvais' presidency back a few years ago, when his focus was the Year of the Patient. And we know that actually a Year of the Patient is every year's focus. And from there, Patient-Centered Care Committee was really formed with its mission to relook at various offerings that we're doing, be it within the college, and also how do we engage our physicians in better ways to do that. And this is where the CardioSmart initiative came on board. And CardioSmart, it is an initiative in addition to a web-based and mobile ways of engaging physicians, healthcare professionals, in addition to their patient. So there are so many ways nowadays that we could use tools to facilitate this physician-patient relationship beyond the office setting.
And I understand that there's a recent publication from the college, a new health policy statement regarding patient-centered care. And I wonder if you could mention some of the highlights of this recent statement, particularly as they relate to the future of patient-centered care.
Bill, this is so timely because, as you know well, the focus of my presidency is patient-centered care and how can we improve that. And it is so timely also that this health policy will be published this month in JACC. And to tell you also that people that were engaged in this health policy were not only the professionals, but also patients were on that committee, consumers, health advocates, and basically looking at what should the college and healthcare delivery in general, how should they partner to be able to do that. We have to provide tools to improve this relationship, if you will, make it easier for the healthcare professionals, and bring educational tools for patients. Shared decision making is tremendously important. It is at the center of this relationship, so a better engaged, better educated patient that can engage better with their healthcare professional can make better decisions. We will also have to address payment reform regarding that to allow for that visit to take a little more time, because it really is among the most cost-effective ways to bring out more adherence, better outcome, probably more effectively than any new medication or procedure can bring about. So I'll invite you to take a look at that health policy, because I really think the major beneficiary from this is our healthcare system and our patients.
And what would you say, Bill, that the college, you've mentioned a number of things, what would you say that the college's main initiatives would be moving forward to help implement the strategies that we'll be reading about in the paper when it's published?
I think shared decision-making tools would be crucially important to help the healthcare professionals at the bedside engage patients and educate them better. And they can take these tools home, be it either in paper format or on the web through CardioSmart. This year, and I've mentioned that previously, that the college has put tremendous resources into the relaunch of CardioSmart. So by next year, scientific sessions, we will have a major relaunch for that. Tools, again, to help the healthcare professional and help patients better educate, better communicate, and re-engage and reinvigorate this patient-physician relationship for optimal care.
Well, this sounds very interesting and very exciting and very innovative, and we're all grateful to you for your leadership in this area. So I want to thank you for the time that you've been able to spend with us, and I know I and certainly the rest of our audience will really appreciate your thoughts on this. Thank you very much.
Thank you, Bill, for the opportunity, and I really invite our members to be engaged in this initiative, because it really is to the benefit of their patients that they care so much about.
Thank you so much.
Thanks again.